Tragically, I lost my son Ben to a fentanyl overdose. It was the hardest thing I had ever had to endure. It's happening across Canada. Fentanyl is wiping out an entire generation of our people. So we started a foundation, Guardians of Recovery, to help people with mental health and addictions who are struggling and not included in society. We've done a great job of including people with disabilities in our society. Now imagine a world where people with mental health and addictions have that same level of inclusion. That's what we're about to do. We are inviting you to take part in one of the most progressive and creative initiatives of our time, building sober living homes for our people to make sure they are cared for and have an opportunity to completely come off substance and live normal, productive lives.
Well, hello, everybody. Welcome to the show. Tonight, I have a super special guest with me who is chiming in all the way from Alberta, Dr. Robert Tanguay. And I'm going to read off all of your long list of accomplishments, which is pretty impressive, I must say. But welcome to the show, Robert.
Thank you for having me. And I don't think we need to go too far into an overly long bio.
I got to kind of give our viewers a context for where we are in this conversation, because we're going to dive into addiction, harm reduction, and all of that. So I'll tell them the basics. So sure. You're a psychiatrist who's completed 2 fellowships, one in addiction medicine and the other one in pain medicine. And you are also a clinical assistant professor with the Department of Psychiatry and Surgery at Cummings School of Medicine in University of Calgary. Right?
That's correct, yeah.
And then the part that I find most interesting is that you are also the co-founder, developer, and chief medical officer of Newly Institute. And this institute is a rehabilitation and return to work program that provides medical and psychological intervention for people living with mental health disorders, things like PTSD, depression, anxiety, addiction, and chronic pain. Yeah. You have a whole lot of other accomplishments, but hopefully through this interview, we'll get into some of those things. And I know that you have kids at home and they're in the background.
Yeah.
That's totally cool. We love all that stuff on this show.
Great.
So I guess the first thing that I'd like to start with is your journey in life, how you got into psychiatry. Let's hear a little bit about you, and then we'll dive into your Newly Institute as a facility, and then we'll jump into harm reduction. How's that?
Yeah, sure. I think that for myself, I had no plans of going into psychiatry. I had spent 10 years working in business. I was living in New Zealand, and I was a college dropout, Medicine Hat College when I was 17. I simply wasn't ready, didn't know how to study, didn't really know what I was doing. I spent years in business. I was a corporate VP living in New Zealand, and we were marketing franchises, and my job was to help set up the franchise and then fix it when it wasn't going well. So that was kind of my life at that time. But I always had this belief I had to go back to school. I messed up something that I think I could have done better at. I decided that due to some issues with work, and I just had an opportunity to leave. I took the opportunity. I moved back to Lethbridge, Alberta, and started in college. And 14 years later, hiding in academia, came out with a medical degree at the University of Calgary. Did my specialized training in psychiatry and subspecialized in addiction and pain. And I think that when it came to kind of addiction and pain in psychiatry, I enjoyed my psychiatry rotation, but I grew up in a small town. In that small town, a lot of us experimented with drugs and alcohol and partying in high school, and many of us kind of moved on, and some people didn't. And I had a brother who really struggled with addiction. Friends, my wife's family, and some of her sister and some friends, and a year ago, I lost my brother to addiction, and he was found on his bathroom floor. About 2 years ago, I lost my best friend to addiction. He was found alone on his kitchen floor. I lost my best friend from childhood, and he was also found after an overdose. He was probably a loss to a toxic drug supply, and the other two were true losses to addiction. And I think that often physicians are labeled as not having lived experience just because we're a doctor. How could we possibly understand? I really understand what it's like to have addiction affect a family, affect relationships, affect each of us personally.
Yeah. So you're in a really good space from two perspectives. One, you have a background in business, which is great for Newly Institute. And also, you're like me, you're completely surrounded by people who have, had succumb to the fentanyl crisis, have addictions. And I think it's not just you and me, it's like everybody that I speak to these days.
Yeah, I think so. I don't think there's very many people who haven't been affected now. I can't even think of someone who hasn't been, because it's affected my friends and family and circles.
Yeah, so you must be extremely busy.
Yeah, I'm busy. The Newly Institute was, after being in the public system, and I developed pain programs and opioid programs for people with chronic pain. I shifted into building the rapid access addiction medicine program, and had some difficulties with the public system and the bureaucracy and so forth, and really decided there was a gaping hole in first responders. I was working at an operational stress injury program, treating basically RCMP officers and veterans, and really didn't understand why we were waiting 18 months before we would suggest they may be well enough to do something. And we developed an intensive return to work and rehabilitation program for first responders. We mostly treat police officers, EMS, fire, nursing. But now we've taken all of that data and realized, wow, it works really, really well for everyone. And so now we have intensive outpatient programming dedicated for anyone we treat, physicians and city workers and people on long-term disability, and people who just want something better from the system that's intense and going to do it. At the same time, I spend most of my time at the Rapid Access Addiction Program in Calgary under Alberta Health Services, which is one of Canada's largest addiction programs for the outpatient. We served over 11,000 patients last year in Calgary. And we provide rapid access on demand to opioid agonist treatment, to counseling, to psychotherapy, to psychiatry, and access into the inpatient treatment centers and that system here in Alberta.
That's amazing. I mean, that's what we're advocating for and fighting for here in Atlantic Canada. Is we can't even get people into detox and rehab, let alone have an on-demand access. Would be a dream come true for us, for sure.
It was a pet project. It took us a couple of years. We built it during COVID. We had to do it without the support of our public healthcare system, but with the support of ministry here, and developed a grant and put together everything, then went back through the public system to get it done. But you're right. It is the ultimate goal. You need immediate on-demand access to evidence-based treatments. That is how good health policy is developed. You have a disorder, a disease, whatever it may be, you need access to first-line treatment. You don't start with experimental treatment. You don't start with unknown outcome treatment. You certainly don't start with palliative care. You start with the belief that everyone can recover. No different than in cancer. We want everybody to ring that bell. We start with the belief that everyone can recover, not with the belief that, oh, by the way, here's your palliative care person, and we should actually have a debate. Should we spend money on treatment?
Yeah. That to me is, ridiculous, considering what my son Ben went through. And also my oldest brother had bipolar and schizophrenia, and it all onset when he smoked weed. So he had cannabis use disorder.
Yeah.
So, yeah, I'm with you all the way with all of this, which is why I was so anxious to have you on the show, because, our vision is to get there. So perhaps you'll be my mentor in all of this. Hint, hint, nudge, nudge. But we do really need, my hope is that all of Canada gets to this place. And that's why we built Guardians of Recovery as a national organization, to do exactly that. Get all the voices out there, get everybody on the same page, and get these things in as fast as possible. I'm super interested in finding out, once you did build your own model, of people getting back to work, how did you shorten that? Because this is a business case as well, right? People back to work, people are more productive, organizations are more effective, businesses are more fluid. How did you increase that or decrease that time frame in terms of when they got back to work?
Well, we intensified therapy. So our first clinic opened in Calgary. Our second clinic opened in Fredericton. And the focus on it was intensive therapy. So people would come in and they spend, 20, 30, 40 hours a week in our clinic undergoing therapy. And if you think about that, in 6 weeks, 8 weeks, 10 weeks, they're getting what would be equivalent to many years of therapy, seeing your therapist once a week or once every 2 weeks for an hour, hour and a half.
Yeah.
And we also really believed in the combination of group therapy and individualized therapy. So individualized, one-on-one, trauma-focused therapy, and everything being evidence-based. So acceptance commitment therapy to deal with the moral injuries and the injustice and the anger, cognitive behavioral therapy for insomnia. The first-line treatment for insomnia is CBT, not a prescription.
Right.
Mindfulness.
For people who don't know what CBT is, cognitive behavioral therapy, which has nothing to do with medication. Can you define that for people? Just give us a quick.
Yeah, absolutely. So it's approaching the thoughts and the behaviors that we have. So with regards to insomnia, a lot of people have worry thoughts when they go to bed. They allow those worry thoughts to get going. We want to reframe those thoughts. We want to come up with skills. What do I do when I start thinking this way? When I start feeling this way? How do I understand my automatic thoughts, and how do I shift those automatic thoughts from the catastrophic thinking that one is having to reframing it in a more appropriate way? What can I do when? That is the key of most of our cognitive behavioral treatments. And there's several formats. There's CBT, there's DBT, there's ACT, these different types of therapies, but they're really homework-based, skill-based, like going back to school and learning skills.
Right. And learning to be self-observant, self-aware, to be able to self-reflect, to be able to see the cause and effect in your behaviors, and to be able to identify them.
Yeah, and you throw in mindfulness and being mindful of the moment, being aware of what's happening. What I love about mindfulness, it's knowing what you're thinking when you're thinking it, knowing what you're feeling when you're feeling it, knowing what you're doing when you're doing it. And to give you an idea, the opposite of mindfulness is autopilot when you're driving. We've all been there.
Yeah.
That's the opposite.
Got it. Cool. Okay. So, and then I noticed that in Newly Institute, it says one of your methods is fusing biopsychosocial spiritual treatment. What does that mean?
Yeah, so biologically, we have psychiatrists, addiction medicine physicians, and primary care physicians, and we have no problems in infusing evidence-based medications, or in some cases, for the most severe of trauma and depression, anxiety, using some intensive treatments such as ketamine-assisted treatment to stabilize the individual's autonomic nervous system, to immediately turn off the intrusive suicidal thinking, to stabilize someone to go into the therapy. We also work with occupational therapists to start thinking about what happens after the anticipatory anxiety of returning back to work, getting one's life back and what that means, transitioning back into reintegrating back into society and back into life. And spiritually, we use things like drum circles and mindfulness and meditation and artistic therapy, things that can, kind of get to the core of change and building resiliency.
Mm-hmm. Yeah, that's phenomenal. You're speaking my language entirely with all of that, because I think that getting back to a life that you enjoy is this holistic experience of your own self-expression. And, to really be authentic in your life. It's like, this is who I am. This is my self-expression. This is my capacity to make a contribution, my purpose in life, my purpose of work, that sort of thing.
Meaning. Bring
Yeah.
meaning to one's life.
Yes, indeed. Indeed. So that's so interesting. So I know I get 2-3 calls every single day from parents whose kids are on death's door. And I can feel what they're thinking right now. It's like, how do I get my kid into Newly Institute? So I see that you're expanding across Canada. What's the plan? And can people from Newfoundland go to one in New Brunswick, for example?
Yeah, well, I mean, we are already treating first responders from Newfoundland who come down and stay in Fredericton. We have the private window for individuals who are looking for care. The thing to remember, we don't treat children, so you have to be over the age of 18.
Yeah.
We certainly would love to see an expansion of a national system of treatment for our youth and adolescents, which is sorely lacking all over this country. And that's probably where I spend a bit more time in my policy side, and where I spend a lot of time trying to help support the development of a recovery-oriented system of care here in Alberta. But for adults or for young adults who are looking for help with trauma and depression, anxiety, they can absolutely access the Newly Institute in Fredericton if you're out east.
Mm-hmm. And our government pays, once people have gone through rehab here and they are still struggling, which wouldn't be surprising because programs are only 30 days, then they can apply to go outside the province. So this could be a possibility.
It could be, and I am absolutely not knowledgeable enough to know the ins and outs of that process, but absolutely.
Yeah. Okay. Well, I'll keep that in mind. I have helped a number of people get to out of province treatment centers, so this will be the next one on our list. Okay. Right. Shifting the conversation a little bit. Just to finish up on that piece. So will Newly Institute be expanding into all the provinces or just some?
That is a great question. We have some incredible investors in Newfoundland, and I've had the opportunity to be there several times. I absolutely love it. There was plans of going into Galway there in St. John's, and it just didn't quite work out. We are probably looking at opening in Halifax next, sooner rather than later. But the ultimate goal is a national expansion. We have recently had a shift in control a little bit with a large international firm who's coming in and working with us. So it is likely that we will also be expanding internationally, and then also moving into providing virtual care as well for all Canadians from coast to coast to coast.
Very exciting. I think I'm going to come work with you. Okay. On to the next topic, which is right now in Canada, we have 22 people a day dying from illicit drug overdose, and we have 23 per day going into the hospital overdosing. And it's just getting worse exponentially. Like, what the heck is going on?
Yeah, I mean, I think most people working in the field of addiction and mental health would say that there is an addiction and mental health crisis.
Right.
You know, a lot of this crisis, when it's a pretty complex and highly variable issue, right? There's looking at how we got here in the first place. There's looking at the lack of access to supporting those individuals who are here now. And there's a severe toxicity in the fentanyl, the non-pharmaceutical grade fentanyl, and its analogs. It's not even fentanyl. It's cut with everything that you can imagine, not to mention the methamphetamine issues, and quite simply the cannabis, cocaine, alcohol, all of these substance use are up. And, you know, Sun Life released a report. The number one reason for being off of work now is mental illness.
Yes.
It is climbing. It is getting worse while everybody else is actually getting better. Your chances of being off of work for a knee fracture or for any other reason is quite low in comparison to mental illness and addiction.
Mm-hmm. So we know all this stuff is happening. When my experience was with Ben for the last 7 years, he died 7 months ago, and we went through 7 years of hell. First, starting with what I call an enabling society. Like, we have, organizations under the banner of harm reduction that go into schools and say, if you're having issues with your kids, you can come on over here, or with your parents, excuse me, you can come on over here. We'll, at the age of 16 and onward, we will, you can hang out here, you can smoke dope here, we'll give you a house, even though you have a safe home, we'll give you a house, we'll pay for your food, we'll give you money for Christmas, we'll pay for your clothes. And what smart teenager is not going to get emancipated and take advantage of that? So that's one thing. But what they don't say on the brochure is, while you're out here, you're going to do drugs, get addicted to drugs, see murders, get into prostitution, see rapes, could possibly get raped yourself, end up with Hep C, probably end up with AIDS, and then you're going to die.
Yeah, I mean, we look at trying to reduce the harm of individuals using drugs. That's one thing. I think at the same time, the least harmful thing that we can do is not use drugs, obviously. At the same time, human nature is to use substances. There's been one human civilization ever that did not use psychoactive substances. It was an island around New Caledonia. It's because they had no psychoactive substances on the island.
Right.
So, it's kind of understanding that the concept of where harm reduction came from was people are going to use drugs. How do we reduce the harm of that? Right. It was never about decriminalizing behaviors or decriminalizing open drug use or accepting harmful behaviors or quite simply accepting higher risks of death. And, the narratives have shifted. We used to have a narrative of we need to get access to help and get access to treatment and get people into these treatments and into help too. Treatment doesn't work. help doesn't work, the best thing that you can do is reduce the harm of the substance. It's almost kind of a flip, right? We don't introduce palliative care to someone with cancer the first time we meet them. Sometimes we have to because of certain circumstances. Same thing when we're meeting someone the first time trying to get help. The first thing that we should be doing is allowing them the access to level 1 evidence-based treatment.
Yeah.
And unfortunately, that is not the case in our country.
Yeah, we seem to be subsidizing addiction. We aren't subsidizing recovery from addiction. And that's like at every turn, whether it's your living accommodations, most of the shelters, for example, are low barrier shelters, which mean you can be using drugs even on the premises. Like these are all very like, here's all the tools you need to continue using drugs. And where's the incentive for people to recover in that equation? Like when I think about the definition of enabling is when it enables or facilitates the use of something that is self-destructive to yourself. So like if we're giving people crack pipes, if we're giving people, tools in which to use without roads leading to recovery, I'm all for it if it leads to recovery. But if it's open-ended and there's no like exit route to recovery, then I feel that personally that's enabling. But I'm very interested to hear like what you think we should be doing at this point with all of this.
Yeah. So look, I'm going to say at the end of the day, without a system that allows people to access recovery free and easy accessibility on demand, we are struggling. So, if you think about many of us have worked in this area for many, many years. And for many, many years, we've advocated, we're an appendix in the healthcare budget. We are a small subset of mental health funding, which is already underfunded. Right. We are not covered under the Canada Health Act. We are not covered under universal healthcare. That's where harm reduction comes from. There's no access to anything else. We have to try to do our best to prevent people from getting worse. The real problem comes down to the provinces and a lack of political will to get people into access treatment. The healthcare systems are run by the provinces. The provinces have to step up and say enough is enough. We are going to make sure that every single person in our province is going to have access to treatment. And we are going to figure out a system that allows that access, whether they're in jail, whether they're in hospital, whether they're in university, or whether they're at home just needing to pick up the phone, or whether they're in a shelter where they're at their most vulnerable and in most need. They need access immediately. And that doesn't exist. So when that doesn't exist, we have no choice. It's look, we can't get you into treatment. There are no detox centers. There are no addiction medicine doctors. There are no ways of getting you into help. So if that's the case, let's provide you with everything we can to believe that we're going to reduce the harm of the drug use that you're going to continue to use because you have nowhere to go.
Right. Now that sounds right and bang on to me. The only problem is we're spending so much money on harm reduction that if we just spent that same amount of money on recovery, we'd have it solved.
Like, yeah, that's a great comment. I mean, I remember being interviewed, oh my goodness, I don't even know now, many, many years ago when we were just starting to roll out some harm reduction programs. And the concept was, we're in a crisis. We got to do something now while we prepare to roll out treatment system. Except the treatment system never rolled out. Money never came. Our opioid clinic in Calgary, to give you an example, went from 300 people to like 1,500 people with not $1 of funding. It was shocking. And we were watching money roll out to harm reduction programs without rolling out to treatment programs. This is a failure of a provincial government. This is a failure of a healthcare system. This is a failure of our healthcare executives. And this is what we as Canadians have to say we will not accept. I will not accept that if I have a heart attack, I can't get help. I will not accept that if I need screening because I'm not feeling well, I can't get help. I will not accept that if I'm struggling with a substance, with alcohol, with opioids, with whatever, that I cannot get help.
Right.
Yet, we don't hear those voices in the media.
Mm-hmm. Yeah, well, that's exactly, why I'm speaking up at the level that I am, is because this conversation has got to come out at this level. Excuse me. We just actually started a video campaign, so a video petition, if you will, where it's just starting today, where people are getting on their video and saying, I want on-demand detox and rehab in real time right now. I'm from St. John's, Newfoundland. I have a son or a daughter or whoever their loved one is, and they're asking for that. We're going to create a video montage that hopefully we can get it Canada-wide and get everybody taking videos and just run the gamut of it and get people to pay attention.
I love it. We need people to pay attention. We're in a crisis right now and people can't get help.
Yeah.
That is a disaster.
It is a disaster. I mean, it's unimaginable that we're losing our kids like this. People are chiming in from everywhere. Annette's listening. Imagine if we had the opportunity to give everyone a chance at recovery. Imagine that. Like, that to us would be home free. Our province does need on-demand detox. Nailed it. I think that comment is to you about the failure in our government. Our healthcare in Newfoundland is awful. Yes, it is. And we need this in Nova Scotia as well. So we have Nova Scotia people here, all provinces and territories. Absolutely. So this is a Canada-wide conversation. And even as good as Alberta is, you guys are light years ahead of the rest of Canada. Your programs and your system, to me, looks like a perfect solution. I can see this going internationally without a doubt. And we need to be able to take your practices and adopt them as fast as possible across the country.
Yeah, but we got to remember, it can't happen overnight, right?
Yeah.
It takes the Alberta model is an 8-year plan. The Alberta model, now first, most governments and provinces only think in 4-year cycles, usually 2 to 3 years in that 4-year cycle. So an 8-year plan, in that 8-year plan, it's going to take significant capital investment for infrastructure. It's going to take significant investment into changing the overall system, adding a recovery-oriented system of care where the Minister of Addiction and Mental Health has significant influence and powers to change justice, to change education, to change community, to change safety. All of that has to be done. And that means changing our jails so it's not incarceration, it's rehabilitation. That means developing a system of care where everyone gets there. Now, remember, the recovery-oriented system of care was first developed by SAMHSA in 2010. It was endorsed in 2017 by the CCSA, the federal agency that does policy for addiction and substance use. And Alberta was the first to do it. Yeah. It's the first time that addiction is no longer an appendix in the healthcare budget, but rather front and center, and money is being spent. But it's not going to see results overnight. Although we see alcohol deaths reducing, we see cocaine deaths reducing, we still are struggling with opioids, but it's going to take time. And as we build it, we will see the benefits of a system that makes sense.
What do you think there's any, do you think it's just because it's going to take a lot to turn the ship that way? Or do you think there are underlying motivations for keeping it this way?
Yeah, I don't know. I hate the fact that there's a political piece to this, but there seems to be. But it's difficult, right? Part of the political piece is that you have a federal government that's funding some programs that are fairly experimental. They're not evidence-based. They're studying as they're building them.
Right.
While at the same time, people can't access first-line treatment. And that's where the politics gets pretty messy is, you have people saying, stop doing this and start funding access to evidence-based treatment. And the Fed saying, we don't fund healthcare that way. That's up to the provinces. And everybody loves to point fingers. The mayor points the finger at the premier, who points the finger at the prime minister, who points the finger at the mayor. It's ridiculous. And quite simply, it does fall on each province to step up because it is under their jurisdiction.
Right. And the number one cause of death in our youth, age 10 to 19, is illicit drugs right now.
Yes.
Like, I don't understand how our politicians sleep at night. Like, if I was leading the country, I could not sleep until I got that solved. And I don't know if it's me because I've lost my son and I just know the pain of what other parents are going through. Or I see us decimating an entire, most of them are young men, 72%, decimating an entire sector of our society. Like, it's not adding up to me. This world is not making sense to me.
It's unfortunate. It took both Alberta and BC quite a few years to start stepping up. Ontario's maybe just starting to do something as well. It's not until, and this is the worst thing possible, but it's not until, someone dies before it actually impacts you. And now most of us know someone who has died. Right. And so that impact has created the change. But we're talking about decades of underfunding to addiction and mental health. Decades. Mm-hmm. We are talking about a healthcare system that doesn't cover universally chronic complex illness. We don't cover it. Yeah. So if we don't cover it, then we're not going to get anywhere. So it's not legislated for the province to do anything.
Right.
So we're in a catch-22 of massive underfunding, believing, well, if I throw a few $1 million at it, we'll change it. This is a multi-billion-dollar problem in Canada. Yeah. Billion-dollar problem.
Do you see an opportunity in the midst of all that chaos and crisis? I do, but I'm just wondering if you do.
Well, I mean, opportunity. I would hope that Canadians stand up and say enough is enough. And that opportunity does lead to the change in the Canada Health Act. That change in the act starts saying that we will take care of our most vulnerable. This isn't about a white old man having a heart attack anymore. This is about young, healthy individuals who are most vulnerable, who need the help now. Mm-hmm. And we've just got to keep saying enough is enough. If this isn't a major political issue on the next election, then we have a major problem. And I really doubt it won't be. If each province isn't talking about this at the provincial elections, and somebody isn't saying enough is enough, we're going to build a system where everybody can get help, then you shouldn't vote for that person.
Exactly. Don't vote for them. I had a very interesting guest who was on the first professor of addiction recovery from Leeds University, talking about recovery inclusive cities and villages. And to me, when I look, this is all about architecting a future that we want to live into, that is inspiring, that is, something that's sustainable. That to me is the only piece of hope that I've heard so far. It's like, how do we, and there's 30 of these cities popping up around the world, like sober cafes, sober inclusive recovery villages, that kind of thing. What do you think about that?
100%. I in a lot of the PowerPoint presentations I do, I have this picture of a place in South Calgary. It's a brand new community. It's not a recovery community, but it's just the coolest thing where you drive in. It's got a roundabout at the end of the block. There's only one entrance. It has a bunch of shops with a bunch of apartment buildings over top and a central community center that has a little mini movie theater and a lounge and a water slide and pool and a gym. And it's like, that is what a recovery community should look like. But it has to come down to we as society celebrating recovery.
Yeah.
You know, when you're done with cancer treatment, you ring the bell and you celebrate it. When you're done with addiction, you hide.
Yeah.
You don't want to tell anyone. We should be celebrating it. We should be high-fiving. You know, when you're out for dinner and someone says, oh, I don't know if I want to have a drink, we should be not judging, not questioning, but rather being good with it. Maybe they're in recovery. Maybe we should be celebrating it. Maybe they're just starting the process for themselves. We need workplaces to celebrate recovery. We need universities to celebrate recovery. And you know, we have an excellent recovery campus here at University of Calgary that is just unbelievable. These are the things that we need to do. And yes, maybe those are the opportunities where suddenly recovery is a big thing, not a bad thing.
Yeah, I want to create recovery retreats. Like in Newfoundland, one of the most beautiful scenic places on earth. Like we can have recovery treats on the cliffs with art and music and people coming from all over the world to come to our inclusive recovery retreats. That's what I see in the future. But I'm interested in this recovery campus, you said, in Alberta. How does that work?
Yeah, so the recovery campus is simply an area at the University of Calgary that celebrates individuals who are entering recovery, trying to recover, trying to move on from addiction or substances. You know, what's one of the most triggering place for someone in recovery to go to? It couldn't be more triggering than a college campus. And I think that that is a big piece of trying to celebrate this and trying to help people move on. And that's something that they're trying to do in Alberta, is these recovery campuses. And one can only hope that this will continue to grow and build as really an important piece, that it doesn't matter where you are. It doesn't matter what you're doing. You're accepted and celebrated for beating a horrible disease.
Yeah, exactly. Well, I think that it's gaining traction because Guardians of Recovery now, our group has 5,100 people in it. And the thing that people love the most is like, here's where I was in addiction and here's me recovered. It's actually, you know, I'm 2 years sober. I'm a mom and I've got my kids back. And there's huge accolades, huge, you can feel the excitement right through social media. And I think that's the power of social media used for good. I also think the power of social media on our page with this, you know, lobbying the government with your videos and saying that you stand for on-demand rehab and detox is the best way to use social media in this. Is there anything else out there that people are doing that you think we should be adopting?
Yeah, well, first of all, I think you should have Victoria Burns, who started the recovery campus at U of C, on board. So give her a shout. Happy to connect you. She's fantastic. I think one of the other really cool things has been in Alberta, the transformation of our provincial penal system into therapeutic living units. So when you go to jail now in the provincial side, 2 years less a day, you have an opportunity to enter into basically like staying at an inpatient residential treatment center. These therapeutic living units are transforming incarceration to rehabilitation and helping people stop the cycle of going in and out of jail, but actually recovering from all aspects of addiction.
That's so important, because what I tend to be dealing with in calls right now from parents is people who are in a state of schizophrenia. They can't get into the Waterford Hospital. They're held in the jail, and they're actually not fit to stand trial. They're just people who are really, really, really sick. And you know, the worst part about mental illness and anosognosia, which is present with schizophrenia patients, bipolar patients, they'll tell you they're perfectly fine. So even though they have a track record, they can't get into, they can't even get to court, let alone manage themselves. They've overdosed multiple times. But then the judge will say, you know, are you coherent? Do you know what day it is? And okay, they're fit to stand trial. And then they have, then they're their own worst enemies because they have no diagnosis, basically, no preliminary. And that is so important that we have a therapeutic division within our jail system, because most of the people in there are dealing with addiction.
Absolutely. And, Dr. Paul Sobey is the one leading this here in Alberta. He's former president of CSAM, the Canadian Society of Addiction Medicine, has been an advocate of recovery for many years. And I agree with you 100%. Look, this shifts you into the concept of mandated treatment and drug courts and getting people the help that they need. Because you're right, a lot of people don't have the capacity to make the decisions that need to be made. Aren't making the decisions that somebody such as yourself or I would make, something that the majority of people in the community would make. This talks about capacity, and people with severe addiction do not have the capacity to make the decisions, are putting themselves in serious risk of harming self or others. And this is where the healthcare system needs to intervene.
I'm so glad to hear you say that. That's music to my ears. So it sounds like I got to get Victoria Burns and Paul Sobey.
You betcha.
Into my next podcast coming up. Okay. Well, wow. That was fantastic. Do you have anything else you'd like to say?
No, I would say for everybody listening, I really believe in hope. Hope as an acronym is hang on, pain ends. And, at the end of the day, we just got to keep advocating. We've got to keep sending letters to our politicians. We have to keep telling them that, my loved one, my family member, my friend, I deserve help. And it is time that we stop the discrimination, we stop the stigma, and quite simply, we stop the frank racism that is around the addiction and mental health concerns that we see in Canada. And we start helping these people get help and quite simply funding it. And yes, it's going to cost a lot of money, but Canadians deserve it. You deserve it. We all deserve it.
For sure. And in the long run, it will save a whole lot of money, because the fallout of not dealing with it, I think, is way more expensive.
Absolutely.
People are saying, oh my God, he just nailed it. Thank you so much. People are so grateful. So thankful. Oh my God, he's phenomenal. Robert, hope to have you on our show again sometime, and take care of yourself and all those kids. You're a man to watch out for. Very, very inspiring. So happy to have you on the show, have your expertise, and have your new institutes come across Canada. We might put up our hand to have one here in Newfoundland. So that's something else to talk about as well.
Well, thank you so much. And thank you for what you're doing. You're part of the solution now. You are part of why we're going to change this.
It is.
And, it is appreciated very much.
It's my purpose and my destiny. I feel like my son, Ben, is driving every piece of this. Yeah. All right, folks, that's it for tonight. Have a great Easter weekend, and we'll be talking to you next show. Over and out.